Low-carb diets beat low-fat diets in helping type 2 diabetics reverse the disease and get off insulin therapy. Dr. Ben Bikman.
A study that was published that reviewed studies in type 2 diabetics looking at insulin therapy concluded, and I quote, "There is no significant evidence of long-term efficacy of insulin on any clinical outcome in type 2 diabetes. However, there is a trend to clinically harmful adverse events. Some of these adverse events are dramatic, including 2 times greater risk of cancer and 3 times greater risk of heart disease mortality." So when we give the type 2 diabetic insulin, we're making them fatter and sicker than they were before. And what do you think happens to insulin resistance? Given the role of hyperinsulinemia as a cause of insulin resistance, insulin therapy in a diabetic makes the insulin resistance worse. They have to give themselves ever higher doses of insulin as the body becomes ever more resistant to it. I think giving a type 2 diabetic insulin is similar to giving an alcoholic another glass of wine and hoping that will solve the problem. We are giving the person more of the very thing that's causing the problem. I want to highlight 3 typical low-fat, the conventional thinking, the dogmatic dietary advice, low-fat diets, low-carbohydrate diets, and intermittent fasting. This was a study that looked at a small cohort of people with type 2 diabetes who were on insulin therapy, and they each chose a different form of intermittent fasting. Within just weeks, their insulin sensitivity had improved so much that they were able to stop insulin therapy. In the case of a low-fat, or which is synonymous with high-carbohydrate diet, I want to highlight only one study done in the late 80s by Gerald Reaven, a legendary diabetes scientist. He took patients with type 2 diabetes and put them on a high-carbohydrate, low-fat diet that followed perfectly the recommendations of the American Diabetes Association. And he concluded, and I quote, "These results document that low-fat, high-carbohydrate diets containing moderate amounts of sucrose have deleterious metabolic effects when consumed by patients with diabetes." So we've known for 30 more plus years that the conventional dietary advice for diabetics may make the situation worse. Now, to highlight low-carbohydrate diets, I want to present data that has pitted the two against each other, low-fat versus low-carbohydrate. What happens to insulin when we eat these 3 macronutrients? When we eat fat, insulin won't change. When someone eats protein, there can be a modest or higher than modest effect on insulin. When someone eats carbohydrate, which in nature generally occurs as a pure carbohydrate, there can be a significant insulin effect, indeed 10 times higher than normal, and stay elevated for hours. Of course, not all carbohydrates are created equal. A piece of bread, for example, has a very different effect than, say, a serving of broccoli. Now, let's look at what happens in humans when they're put on 2 different diets. Only a significant reduction in the glucose on the low-carbohydrate diet group. We saw a modest reduction in insulin, 16%, on the low-fat diet, and then we saw a 50% reduction in insulin levels on the low-carbohydrate diet. We saw similar reductions where the low-carbohydrate diet had multiples greater improvements in insulin resistance than the low-fat diet did.
Low-carb diets beat low-fat diets in helping type 2 diabetics reverse the disease and get off insulin therapy. Dr. Ben Bikman. In a review of studies of type 2 diabetics and insulin therapy, the study concludes there is no significant evidence of long-term efficacy of insulin on any clinical outcome in type 2 diabetics. However, there is a trend to clinically harmful adverse effects. The adverse effects include 2 times the cancer risk and 3 times the heart disease mortality. Dr. Bikman says, giving patients insulin makes them fatter and sicker. What happens to insulin resistance during insulin therapy? Makes it worse. They must inject more insulin as the resistance grows. Dr. Bikman says, giving a type 2 diabetic insulin is like giving an alcoholic another glass of wine, hoping that that will resolve their problem. giving them more of the thing that is the cause of the problem. In studies of diets on insulin resistance, low fat, which is what is typically recommended by the American Diabetes Association and others, versus low carb and intermittent fasting. In the studies on intermittent fasting for those on insulin therapy, within weeks they improved so much they stopped injecting insulin. In a study on low fat, which is high carb diet, in the late 1980s, Dr. Revan followed precisely the ADA recommendations. He stated, "These results document that low-fat, high-carbohydrate diets contain moderate amounts of sucrose, have deleterious metabolic effects when consumed by patients with diabetes." Dr. Bikman says, "We have known for 30 plus years that the conventional dietary advice for diabetics makes them worse. Clinical studies of low-fat diets versus low-carb. What happens to insulin when eating these macros? Fat, there's no change in insulin. Protein, there's a modest effect. Carbs, it's a 10 times higher effect on insulin than normal. And the insulin stays elevated for hours. But not all carbs are equal. For example, a piece of bread has a very different effect, which is large, than a serving of broccoli, which is a small effect." Dr. Bikman cites one final study, human patients on low fat versus low carb. Low carb had a 15% reduction in glucose, a 50% reduction in insulin, and a 56% reduction in insulin resistance. Annotated and summarized, easy to share with loved ones. To access these annotations, go to doctorstotrust.com or see the description below this video's title.